Hello, my name is Dr. Aaron Marks. I'm the dentist at Smiles of Mathews in Hudgens, Virginia. Today I'm going to be answering some questions about what we call all-on-4 or all-on-X teeth, dentures, implants. Has a few names. So all-on-4 or all-on-X, we say X because sometimes we use 6 implants. 4 is the minimum. 6 is usually the most I've ever done or needed. Just depends on the size, what we're working with. What that is, there are dentures that screw into the implants and they don't come out. So they're a lot more aesthetic. They're a lot more functional. Yeah, just aesthetic and functional. They're a lot better. The restrictions are those that where we determine who and who can't, or who and who aren't qualified for them. If you're diabetic, if it's uncontrolled, then we're hesitant to place implants. If you're a smoker, we're hesitant to place implants. If you've had head and neck cancer, we're hesitant, or radiation. What's the other one? If you're on a bone therapy medication, they're commonly called bisphosphonates. That's the drug class that are used. We're also very hesitant. Not necessarily a no-go, but something to be very aware of and talk with your dentist about pros and cons and risks and benefits. So they're not much different. It's the same type of, or it's the same implant. We're just using it in a different way. The implant itself is replacing the tooth root. So if we're doing an individual tooth, that's just the little titanium screw that goes into the bone, which then the crown goes on top of. So good candidates would be, again, someone that doesn't have diabetes, isn't a smoker. Either you have existing dentures or you don't want to take care of what you have left because there's a lot of issues that you're aware of, and you just want to cut and run, which is totally valid. And I've taken care of a lot of people like that, and they're very happy with the outcome. You don't have to worry about decay anymore because you don't have teeth. The one thing you do have to be aware of and keep them clean is gum disease. It is a risk when you have implants. Depends on the amount of bone that's missing, but generally that's why we do those, is because you don't have a whole lot of bone left or very minimal, and conventional dentures don't stay in or have a very hard time staying in. So the process is depending on where we're starting. If you're starting, you don't have any teeth, you have current dentures, what I will generally do is use those existing dentures as a temporary, or we use those while we're waiting for things to heal. So for that case, first step would be placing the implants in where we determine they need to be. You definitely want to be somewhere that the dentist takes a CT scan. Don't want to be doing this type of work without that. So we put the implants in, and we attach the temporary dentures to those implants most of the time. Sometimes there's instances where we can't do that, but that's our goal, is to place those dentures and screw them to the implants. Now we let things heal for 3 to 6 months. Once that's healed and all the implants are good to go and solid, we then do the process to make the final, what we call hybrid dentures. And that is a multi-step process. Everybody tackles it a little bit differently depending on the workflow that they have learned and know how to do. Or the way that I do it is I'll go through the steps of making a prototype. So you'll wear that. We'll make sure the color and the shape and the shade and everything is right about them before we make the final. The final is much more aesthetic, longer lasting, all of that. So the prototype, as we call it, is kind of a try-in phase to make sure we like and make any adjustments that might need to be made. So depending, again, what we're doing, if we're going from no teeth to a hybrid, depending on the surgeon, the dentist, whoever's doing it, it can take 4 to 5 hours. A lot of that is waiting for the lab work for the denture to be attached to these implants. If we're going from extracting majority of the teeth, and then if we have to do bone grafting, placing the implants, doing all that, that's a whole day. It is a permanent solution so long as the implants aren't rejected or get infected. So the ability to chew is what we're after. So we do know from many studies that conventional dentures give us about 10 to 20% chewing efficiency. It also conventional dentures reduce your ability to taste because it covers the roof of your mouth. You have to hold your facial muscles in a certain way to keep them from moving around a whole lot. So quality of life is less because most people can't eat as much as, or the types of foods that they like. Hybrid dentures, the all on 4, all on X, they are super solid because they're attached to your skeleton. So very strong, very stout. And so you can eat pretty much whatever you want. Recovery process is everybody's different, but you are going to have pain that first day with that big surgery. You're going to be put on antibiotics, pain meds. I also have some topical solutions that I give to everybody that helps with swelling. I have a special multivitamin that helps with bone building, formulated for that particular situation. So they should last the rest of your life, depending on the material that they're made out of. The ones I use most commonly is zirconia, and that's very strong material. There are some others out there. I like it because it tends to be really aesthetic and strong. Maintenance wise, you're going to need to get regular cleanings, believe it or not, because tartar will collect on the appliance. And then usually once a year, we'll take both appliances, or if we're just doing one side, we'll take the appliance out, we'll unscrew it, clean it, make sure all the implants are still good, clean around the implants right at where the implant comes through the gums, make sure nothing is caught, all of that stuff.